Hawaiian Music 93.5 FM. We are KPOA at 7:31 in the morning on this Good Friday Aloha Morning Show. And as we do every morning, of course, we was just talking with Mayor Mike Victorino. With that aside, we have Dr. David Ulin, who is our special guest from Maui Health, to give us an update and answer some questions from you, our listeners. Good morning, Dr. David, and thank you for holding on.
Good morning, Shane. Following the mayor, that's okay. Shane, he's really doing good things.
Yes,
Hard
he is.
things, protecting us, keeping us strong. That was good.
Making all of those
Please,
decisions.
questions, sir.
Yeah, all right. Well, you ready, Dr. David? We have one first coming from Mike from Kahului. He says, when can Maui public be tested for coronavirus, both infection and antibody immunity? Right now, the drive-thru is full. Without serious symptoms, we are refused testing. A vast majority of infected people are either showing no or mild symptoms. How else, without universal testing, will we know when to return to normal?
Oh, good. Hey, Mike, thanks for the question. That's been the issue for a lot of us right now. And I know there are a lot of frustrated people out there who want to get tested but don't meet the criteria right now. And I've got to tell you, as a doctor, what we want more than anything is more tests and quicker results. We're with you here. Testing is limited right now because of the supplies and the availability of the test kits. We just don't have the number we need. So we've had to save those tests for people most in need, who are especially those, hospitalized. But the good news is I'm hearing that the state may help us in the next week with a rapid test that could get us results within hours that we can use in the emergency room and with our hospitalized. So cross fingers, we think that's great. Presently, Hawaii has tested a higher percentage of our population than all but 7 other states. Pretty good, nowhere near enough. And unfortunately, I think it's going to still be a while before we get that large-scale screening, either the rapid test or the antibody test. I think except for that great pop-up events, and you just heard the mayor talk about it, what they're doing in Kahului, I think they hit over 500 people yesterday. They're going to do it again today. It's great. And I know Shane will let you know when those things are coming, folks, so just listen here. Yeah,
that's for sure. I just got this one in from one of our listeners saying that the process of the test kit, is there blood work involved?
Yeah, so most of the test kits right now, the rapid test kits are all nasal swab, which is, Q-tip up the nose, making you cough and sneeze. And that's the majority of them. There are some new tests that are coming out very rapidly that are blood and will give us more information than we have right now.
Okay, awesome.
And they're coming fast. They're not here yet, but they're coming fast.
Awesome. That's good news. All right, this next question comes from John. If we're unable to find medical use masks, what kinds of alternative fabrics, types of masks might be effective?
Thanks, John. The mayor's issued the order that we should all be wearing masks, and I think it's really a good thing when we're out in public. So, when you're out in public, those cloth masks are good for public places. Still trying to stay 6 feet, but sometimes you can't, like at the supermarket. If you go on the line, CDC has instructions on how to make many different types of cloth masks on their website. Now, I got to say, I'm a pediatrician, so I'm going to tell everyone, please be really careful about placing any type of heavy homemade mask on your kid's nose or mouth. Some of these masks people are making are really thick and might affect your child's ability to breathe. Also, really know that if you exercise in a cloth mask and you're not used to that, it can make breathing quite difficult, make you dizzy. We've had reports of people fainting. Please be careful.
Awesome. That's good information right there. All right. This one comes from Sean. Out of the 442 cases reported in the state, how many have recovered?
Great question. I'd love it. I think we often focus on the negative. I'm really glad to hear a question about the positive.
Yeah.
Everyone should know more than half of the positive cases in Hawaii are no longer in isolation. That's according to the Department of Health, and that means they are no longer considered a risk to others. I know that there have been COVID patients released from the hospital, so I know people are getting better. And just a reminder, most folks will recover just fine and never have to go to the hospital with COVID, 80 to well over 90%. But the ones who do, I think our real thing we have to watch for is if you think you're getting worse during that second week of feeling bad, we need to hear about it.
Mm-hmm.
That seems to be really the key to us.
Wow. Awesome. That's perfect information. And finally, Dr. David, we have one from Matt. And this is an interesting one. Is it safe to surf? And does salt water neutralize coronavirus, or is the virus able to survive in the ocean for extended periods of time?
Very good.
Yeah.
Matt, I'm glad to hear you're still exercising.
Yeah.
I want to remind everybody self-care is so important. From what we can tell, the biggest concern with ocean water and viruses is when wastewater or runoff gets into the ocean, or if there's a really crowded, beach area going on with lots of activity. But that's not the case right now, so that shouldn't be the issue. We don't know very much about this coronavirus and how it's affected or transmitted in ocean water, but we really think that's probably safe. Now, having said that, if you choose to go surfing, and I don't know what the shelter-in-place rules say about that. I don't want to advocate yes or no. I just don't know. I want to remind you, it's always a good idea to rinse off before and after you go in the water. And remember, 6 feet social distancing, so no sharing your board.
That's a good one. You can share a wave, but you can't share the board.
You got it. You got it.
Awesome. Well, thank you, Dr. David, man. Some great questions this morning, huh?
Yes, sir. It was fun talking to everybody.